Hi. So today we'll be discussing ectopic pregnancies. I feel it's very important that every woman should be aware of this ectopic pregnancy. I'll explain why later on. So let's start at the very beginning with some basic information. All of us who were conceived naturally started our lives in our mummy's fallopian tubes. After the fertilization of the ovum in the fallopian tube has tiny hairs, and these hairs gradually bring this embryo from the fallopian tube to the uterus. Where it will implant and grow. For every 200 normal pregnancies, one pregnancy will remain in the fallopian tube. This pregnancy, which is in the wrong place, is known as an ectopic pregnancy. This pregnancy, which is situated in the fallopian tube, now implants on the wall of the fallopian tube. The wall of the fallopian tube is very thin, and the lumen is very narrow. So just after a couple of weeks of growing inside the fallopian tube cannot take it anymore and it bursts, or as we call it, it ruptures. This causes a significant amount of bleeding into the abdominal cavity. This bleeding, if left as it is, could ultimately lead to the lady losing her life. This is the typical common variety of ectopic pregnancy. It's called as a tubal ectopic pregnancy. An ectopic pregnancy is actually a pregnancy which is anywhere except in the normal part of the uterus. So we can get ectopics in various places, like the ovary, sometimes in the abdominal cavity itself. We have seen pregnancies implant on the previous caesarean scar, sometimes the corner of the uterus, and even sometimes the uterine mouth or the cervix. Now all of these are ectopic pregnancies, but fortunately they're not very common. The commonest type of ectopic is the tubal ectopic, and that's what I'm discussing today. So in this capsule, I have actually only two important points to make. The first and the most important factor to remember is that any perfectly normal woman could have an ectopic pregnancy. And that's why I mentioned that it's important that every woman should be aware of an ectopic pregnancy. An ectopic pregnancy doesn't happen because of the food you eat or did not eat, or the activity you did or did not do. It's just chance, and it can affect anyone. The other important factor is that if we can detect this ectopic pregnancy early, we can actually take care of you very well. We can give you some medicines or injections, and we may not even require a surgery if you come to us early enough. And even if we require a surgery, very often we can save your tube. All provided you come to us early. If an ectopic pregnancy is picked up late, nearly always we'll end up with a major surgery, maybe blood transfusion, and very often we lose one fallopian tube. Once upon a time, all our ectopics used to present late. They would present with a missed period, severe abdominal pain, fainting attacks, and bleeding. The problem with this bleeding was that many women would assume that she's just got a late period. and they wouldn't test for a pregnancy. And this is particularly seen in women who do not track your periods. Please refer to my capsule on maintaining a menstrual diary. I'll leave a link somewhere around. So once upon a time, nearly always these ectopics would require us to do a major surgery, blood transfusion, and loss of a tube. So to avoid this major surgery and loss of a fallopian tube, you need to reach us early. So how do you do that? First, track your menstrual periods. Keep a menstrual diary. Because only when you know exactly when you're supposed to get your periods and you do not, well, that's when you can do the next thing which is most important, and that is do an early pregnancy test. I repeat, if you miss your periods and you are sexually active, you need to do a urine pregnancy test. For some reason which I really cannot understand, many women wait for nearly up to 2 weeks after missing a period to do a simple pregnancy test at home. Your pregnancy tests, which are available nowadays, will give you a positive test within a couple of days of missing it. There's no reason for you to wait for 2 weeks. But if you were to wait for 2 weeks and you have an ectopic, well, you'll lose your fallopian tube. So in effect, we doctors like to treat all pregnancies as potential ectopics. We do not want to diagnose ectopics. We want to rule out ectopics. I hope you get my point. So if you miss your period and you do your pregnancy test as soon as you miss your period, and if it shows it's positive, all you need to do is just visit your obstetrician and gynecologist. And any competent OBGYN will do the needful. What will we do? Well, we'll be probably doing a blood test. And we probably will repeat the same blood test after 48 hours. Or we may do an ultrasound scan. Either way, we will localize your pregnancy. If it's in the right place, well, excellent. If it's not, we'll take care of it. So are some women more likely to develop an ectopic than others? Yes. People who have had previous tubal surgery, people who have had infection of their fallopian tubes, people who have conceived after infertility treatment, and also those who have had a previous ectopic in the past. All these people have higher chances of developing an ectopic pregnancy. There is some debate about whether we should test every single patient for a potential ectopic, especially since the incidence is only around 1 in 200. In other words, to pick up one ectopic, we have to test 200 women. So then the cost issue comes in play. So personally, I prefer to test all my patients for an ectopic pregnancy. At the very least, I'll explain to my patients why I like to do it and why I would like to, pick up an ectopic pregnancy as early as possible. Well, you have the option to refuse the test after understanding why I feel you should do it, but I will offer it. And patients who are at high risk for ectopics, well, I definitely recommend that you do it. So once we find out that you have a tubal pregnancy, what do we do? Well, it's quite simple. If the detection is early, nearly always nowadays we give you some medicines. Usually an injection, sometimes tablets. And very often these medicines work and they dissolve away the pregnancy and the fallopian tube is not damaged much. But remember, these medicines don't always work. So you need to be on constant follow-up and you need to be close by around the hospital, or in some cases we need to keep you admitted. You need to stay close by to the hospital because if it doesn't work, at least we have a quick option of taking you up for surgery. Because when we do a surgery, and usually it's a laparoscopic surgery, which is a minimal access surgery, we can actually do a surgery in which your tube is not actually cut away, but we cut into the tube, remove the pregnancy, and the tube is conserved. So whether your doctor would like to give you medicines or would like to do the laparoscopic surgery, well, that depends on various factors like the size of the ectopic, whether there's a fetal node present or visible, if there's a cardiac activity present or not. So there are a lot of factors which govern whether we would be giving you the medicines or doing this laparoscopic surgery first. But either way, if you come to us early, we have these what we call conservative options in which we can preserve your fallopian tube. And if the tube has ruptured, it's very difficult to preserve the fallopian tube, and unfortunately we need to remove it. So the key to a safe management is basically early detection. Early detection by doing an early pregnancy test as soon as you miss your period and meeting your doctor as soon as possible. If your periods are irregular, well, I agree it is tricky, but I would still ask you to do regular pregnancy tests. Okay, so that's your carry home message. So I'll be seeing you soon. Bye.